Today we're welcoming David Jared to the show today. How you doing, man?
Real good. How are you?
I'm doing awesome. Really excited about this. This information is very important to get out there because people are in pain, and there's a lot of things that are unaware in people's minds and things that they can do right now to actually relieve their pain. So I'm very excited to have you on the show today. Out of curiosity, what's the story that got you into physical therapy, and how did you get on the path you are in the way that you're helping people?
Well, like many physical therapists, I have a story that starts off in my years between middle school and high school. I dislocated my patella a few times and ended up having surgery on both knees to basically remake how the kneecap moves inside the femoral groove, and such that it wouldn't dislocate as often. So I obviously did a lot of physical therapy in high school and decided that that was a job that was interesting and a good way to help people.
Awesome. Yeah, I mean, like speaking in the health and wellness space, there's always like usually have an issue with their own health or somebody that they love, right? So that's kind of like the origin of a lot of people. They have a lot of pain and they kind of overcome that and they help people on the other side. And it seems what you've done.
Yeah, for sure. I mean, that almost every physical therapist has a story about going to physical therapy and having an experience where someone was able to identify a problem and give them some solutions and really change the trajectory of their life. And that's physical therapy can be one of the most rewarding careers in that sense because it feels like there's very few healthcare jobs where you can actually see someone go from having a challenging situation and getting into a place where they're really changing the trajectory of their life, and it can be really rewarding.
Yeah, I can see that for sure. Do you want to describe what mobility is for people? And also, is there a difference between flexibility and mobility?
Let me take a little bit of a 30,000 foot view to that question. I like to think of the musculoskeletal system. You know, when you go into your primary care physician and say, my knee hurts, a lot of times, or what the primary care physician should be doing is they should be looking at that knee pain and trying to identify the structure that is painful, because there could be some really big, bad, ugly things that could be happening in that knee. You could have an infection in that knee. You could have cancer in that knee. You could have a blood clot in your lower leg. You could have any number of, big, bad, ugly things that are going on in this knee that maybe someone just thinks is, oh, I'm having this weird knee pain. But once we have identified that there is a structure in your knee that is painful, I like to call that the tissue and lesion, then that's where I feel like the medical system sort of falls down a little bit. Because when they find a tissue that is painful, a lot of times they start blaming that tissue and saying, well, that tissue is the problem. So for instance, the patellar tendon is quite often a structure that is painful in young people, patellofemoral pain, athletes, that sort of thing. And when I get those people coming into my clinic, obviously I'm looking at the knee and identifying that painful structure, but then I'm also looking at the whole rest of the leg to see why is that structure painful. And that question of why is that structure painful is what physical therapy is all about. Looking at how the body moves, looking at how the body can stabilize through that normal motion, looking at how those movements are coordinated with each other is what physical therapy should be, which is resolving the biomechanical dysfunction that is driving the tissue and lesion. And so when we talk about flexibility, you can talk about, do each of the joints in the leg move the way they're supposed to, right? Is the ankle moving the way it's supposed to? Is the knee moving the way it's supposed to? Is the hip moving the way it's supposed to? The pelvis, the lumbar spine, are all of those places moving well? But then maybe flexibility has to do with some of that coordination stuff, because maybe you have good movement individually with all of those joints, but you don't have good flexibility through that whole system in a coordinated fashion. So both mobility and flexibility are important to having good musculoskeletal health.
Absolutely. When it comes to pain, are there some common causes that you see in people?
Yeah, I mean, obviously, I think when I think of musculoskeletal pain, and I think of the average person that comes through, they might have some kind of mechanism of injury, but most of the time it is a pretty mild to moderate mechanism of injury. Like, I was out walking and my knee started hurting, or I bent down to try to lift this thing up and my back started hurting. As opposed to, I fell off a ladder 10 feet and, I had this massive traumatic injury. So a lot of them are these low force, over time kind of injuries. And when I start thinking about that, I start thinking about, okay, well, what is not working in that system such that the structure was not able to tolerate the load that was put on it? And when we start looking around, what we find is this postural dysfunction, sort of stiffness. If you can imagine sitting in a chair where your head's a little bit forward and your shoulders are a little bit rounded and your back's a little bit rounded and your hips are flexed and your knees are bent. That sitting position is where most of us are sitting. That's where we live these days, as opposed to our ancestors, 10,000 years ago, that were hunting and gathering and walking tens of miles a day and pushing and pulling and doing all of the things that they used to do. So our body is not being used the way it was designed to be used, and we're getting stiff into this postural dysfunction. And when you get that stiffness going in that upper back, then it limits how much your shoulder can move. And if your shoulder is limited on how much it can move and you load it in just the right way, then you can either irritate or tear a structure in that shoulder. But at the end of the day, yes, the structure that is irritated or torn is important. Resolving that postural dysfunction is just as important or more important to your overall long-term health. Again, the medical community wants to go in there and do maybe a cortisone injection in that shoulder, which again can be a positive thing in terms of decreasing pain. But if you don't resolve the reason why that shoulder became painful in the first place, then it's bound to come back.
Got it. That makes sense. So again, for the mobility and flexibility, like how do people start to maybe practice that so they don't have so much stiffness in the first place?
I always kind of say, if everyone did yoga from the age of 5, then I probably wouldn't have a job. And so I think about, again, if you think about that sitting posture where your head forward and your rounded shoulders and your hips are flexed, if you can think about where you're standing up and your arms are over your head and you're arching your back backwards, that's sort of the position that you should be thinking about getting in. So there's tons and tons of different exercises and stretches that you can work on to get yourself into that position. And as long as you don't have joint pain when you're doing any of these stretches, then they're all fine. The reality is that as long as you're getting your hips to rotate and move behind you, and as long as you're getting your back to bend backwards and getting your shoulder blades to move and your shoulders to go over your head, and you're moving out of that sitting position, then anything that you do can be beneficial. I have a lot of people do some foam roll stuff to keep their thoracic spine moving, where they roll on the foam roll on their mid back to kind of arch their mid back backwards. I have people lay on that foam roll and do kind of a snow angel pattern to try to get their shoulders opened up and their chest opened up. I have a lot of people do hip mobility, again, all the hip openers that are associated with yoga and whatnot. So I think part of the thing is it's not so much that you're doing any one exercise. it's probably more important to do a bunch of different types of exercises in a bunch of different ways to try to get your body moving in as many ways as you possibly can, as opposed to finding the best exercise. And I think that when people can find a variety of exercises to get themselves moving in a bunch of different ways, that's probably the key. Again, as long as you're not having joint pain, as long as you're not having the kind of pain where it kind of feels like, okay, this is not right, then you can just move on to the next exercise. You just try something else. And if those things don't work, that's when you start talking about like, okay, I'm not moving well and I'm having this pain. It sounds like I may need to talk to a professional about how to get my body moving so that I can then tolerate some of these other exercises. Or ask the question, why can't I move in these ways without it being painful?
That makes sense. So you're a fan of like foam rollers and cross balls and things like that?
So let me clarify a little bit. I don't love the idea of, say, rolling out your IT bands and a lot of the fascial release sort of stuff that people do with foam rolls. I think there's a lot of masochism out there where people are rolling on these things and trying to get their fascia moving and trying to get muscles to release. That's not my favorite thing. I am a physical therapist who believes more that you need to make sure that joints are moving well, and then moving those joints through full range of motion and working the soft tissues in that full range of motion is how you get your body moving properly. And the soft tissues will accommodate to a joint that's moving over time. I don't think that you go backwards. So a lot of times I will hear about people coming into my clinic with IT band syndrome or that lateral knee pain or lateral thigh pain, and they've been doing that foam roll stuff where they're just trying to beat the snot out of that IT band, and they haven't been getting anywhere. And part of the reason why I would say they're not getting anywhere is because they haven't resolved the joint restriction problem that likely exists in the lumbar spine, in the pelvis, and in the hip itself. And if you can resolve all of that, then the IT band says thanks very much and becomes less painful.
That makes sense. When it comes to stretching, there's like dynamic stretching and then static stretching. Do I have that right?
Yeah, I don't do a ton of static stretching. I don't have people do a lot of static stretching. The exception to that is if someone has had say a knee surgery and they're lacking a little bit of extension, that knee is just a little bit bent and it won't go all the way straight to locking out. A lot of times I'll have people do a static stretch where they'll do a low load prolonged stretch where they will just maybe put their foot up on another chair and let that knee go fully straight over, say, a 5-minute period. When I am having people do mobility work, most of the time I'm having them work through the range of motion and try to work those soft tissues through that range of motion in a slow and controlled manner, but not necessarily holding a ton. But again, variety is a spice of life. If you wanted to hold it for 5 or 10 or 15 seconds at the bottom, that's totally fine. There's nothing wrong with that.
Awesome. So you talk about structural stability a lot. You want to find that?
Yeah, I think this is an interesting concept where a lot of times people think about muscles as doing one function. Like the quadriceps straightens the knee, and the hamstring bends the knee, and the calf plantar flexes the ankle. But in function, it's a lot more complicated than that, because of course the hamstrings are attached from the pelvis down to the tibia. So there's a whole host of different things that can be happening between the multiple joints that it crosses. And so when I think of strength and stability, I think of it as a dynamic movement, loading, as opposed to trying to strengthen one muscle. So I almost never have people do single plane exercises. So I would almost never have someone do an exercise where they were just trying to work a muscle to fatigue to build muscle. And people can do that if they're trying to do some bodybuilding or whatever. But I'm looking at how can the whole, say, lower quarter or upper quarter load in function in all three planes of motion. So if I'm going to ask, if I'm working on somebody who has a hip or a knee or ankle problem, I'm probably going to have them do a version of a lunge where they step out and they reach and they do a bunch of different things, because I want their ankle to load, I want their knee to load, I want their hip to load, I want their back to load all at the same time, because that's what function is, right? You don't move your, there's very few times in life where you're going to need to pull with your ankle a weight up towards you, right? I mean, what is the point of getting those muscles moving and strengthening in a way where you're just pulling on it against resistance, as opposed to when you put your foot on the ground and you have those muscles both feel the balance and coordination of an uneven surface, and then have to accommodate to a knee that's bending or a hip that's bending, and then maybe a reach of an upper extremity that's creating a rotational force. So I think that dynamic loading has to be a part of people's exercise routines to make sure that that all of the parts of the system are working together in a controlled and coordinated fashion. And that coordination is incredibly important. You could have strength in that muscle, but if that muscle isn't working well with other muscles in coordination, then you're going to have a problem.
Definitely. When it comes to muscle imbalances, are there common ones that you see?
Yeah, I mean, obviously we see over and over again, you just see way too many people doing chest stuff and not enough back stuff. I don't think anyone has ever come into my clinic with a back that is overly developed, where their chest is out and their back is just this ripped back, and they have these tiny little pecs, that are all stretched out because their back is overly developed. I don't think that, I've never seen that ever in my life. Similarly, I don't ever see overdeveloped lateral hips, where people have too much strength in their lateral hips. That's not a thing. So, yeah, I mean, the common ones that we see obviously are where people are overdeveloping their chest and not getting their back as strong as they should be. Similar in the hip, they're not working on lateral hips and adductors and glutes as much as they're working on quads and hamstrings. Because again, a lot of times people are trying to get a look versus a function, and I'm much more about function than I am looks as a physical therapist, obviously.
Absolutely. I mean, we want to make sure, when we're working out and things like that, we want to be focusing on the antagonistic muscles as well, not just one side of the body.
For sure. Yeah.
I mean, people are working on those show muscles, man.
Yeah. Well, and and then even, when people start talking about core stuff, I still see a lot of people doing, sit-ups and trying to isolate out abdominals and whatnot. And I'm much more of the mind that while abdominals are incredibly important, and the back strap muscles or the rectus spine are incredibly important for stabilization, those things need to be working with the rest of the body. They need to be working with the pelvic floor and the diaphragm, and making sure that you can create movement as well as stabilization at the same time. Dynamic mobility.
Definitely. Is there a difference between what we just talked about in dynamic mobility or dynamic strength?
No, I mean, I guess I think of musculoskeletal health as a combination of mobility and dynamic stability, right? If all of the joints are moving well, if all of those muscles and soft tissues around associated with those joints are moving well, and you can dynamically stabilize through that range of motion, that is a version of musculoskeletal health that I think is really valuable for people, as opposed to feeling like I have to have this one muscle strong that's going to resolve my problem. I think, again, I just see over and over again, I see people trying to do things like, I'm going to strengthen my rotator cuff. Well, I don't have a problem with strengthening your rotator cuff, but your rotator cuff lives in a neighborhood, and it needs to work with how the muscles that stabilize your scapula are working, and the muscles that move your ribs and your thoracic spine. So if you're just trying to isolate out your rotator cuff, you're probably missing the boat that your rotator cuff lives in a neighborhood.
Definitely. So when it comes to all this, like, what is the importance of physical therapy, and when do people actually need it, do you think?
Yeah. Well, I think, it seems like you and your audience are people who typically exercise. Is that fair to say?
Yeah.
So it can be challenging to know, because if you're working hard, as you probably are, there's going to be some pain associated sometimes, right? You're going to be a little bit sore from different workouts and whatnot. So every time you have some soreness, obviously you don't need to go to the physical therapist. But if you have some joint pain with certain movements, and you're not able to work that out with whatever stretches you can try to resolve that with, and I'm going to put a pin in that idea for a second, then it's probably time to have a professional look at that situation and see if there's something that you're missing, and see if there's something that, okay, if I just got maybe, I'll give you for instance, I had a person come in today that had right knee pain. And one of the big things that I found was that her left hip wasn't moving backwards. And she's a runner. So you can imagine, if you take a stride forward with the right leg, the left leg is trailing behind you. And similarly, right, if you take a stride with your left leg, your right leg is trailing behind you. But if that left leg doesn't go behind you, if it doesn't move well going into extension, going behind you, then that is going to create a situation where your body has to compensate for that lack of movement on the left side. And maybe that compensation ends up being where you land with your right foot a little bit externally rotated or something, right? It just messes up your stride enough over 5,000 steps per mile, or not per mile, probably 1,500 steps per mile, where that little bit of change in your gait because of the opposite side not moving very well is creating pain on that right side. So for me, the most important for this particular patient was to get the left hip moving well, so that the right hip was right foot was striking the ground at an appropriate way. I'm gonna come back to what I started to say there, where if you have pain, let's say in your shoulder, the most common thing that I see people do, especially people who exercise and are trying to do stretching and whatnot, is they feel pain, and then all of a sudden they look for a stretch that reproduces that pain, right? So they're like, oh, my shoulder hurts. So like, well, if I really do this big stretch backwards here, I can really reproduce that pain. It's like, well, that's probably not the right answer. I like to call that punching the hippie, right? Don't punch the hippie. If you have something that's painful, finding a stretch that reproduces that pain is probably not the right answer. It's probably the right answer to go the opposite direction is probably a good place to start. But then making sure that everything around that structure is moving well is a second place to go.
Awesome. Yeah. So, like, what should people expect from physical therapy, and also, like, how do they know if it's something they can actually just fix or actually need surgery?
Okay, well, what you should be looking for in a physical therapist is someone who is going to both identify that painful structure and identify the reason why that structure is painful, right? So if you go to a physical therapist and your knee is painful, that physical therapist should be able to say, this is the structure that I believe is the pain-producing structure. And this is what's going on in the whole rest of your leg that is creating extra stress on that structure. And this is why it's going to be helpful for us to get all of this moving and improve the dynamic stabilization of the whole situation. Now for surgery, where surgery comes into this, let's say you're playing some basketball and you injure your knee and you come in and you have signs that you have a meniscus tear. There's a couple of things, there are a couple of possibilities of how that can go. If we get the knee to calm down and the meniscus to calm down and it to scar down and heal, which can take quite a long time, and we can get the leg moving properly. Again, my question would be, is there a contributing factor why that meniscus became a problem in the first place, right? Did you have a hip that was stiff and weak that created an abnormal load on that knee that when you tried to cut, it was in an inefficient position such that the meniscus had stress on it such that it tore? Or is, again, it's almost never where people are moving fantastic and they have amazing strength, right? That just never happens. So if you come in and we can get that knee to calm down and we can get it to strengthen up and we can get everything to heal up, there's absolutely no reason to have a surgical intervention. If we have been working on things for, say, 2 months, and you still can't bend the knee past 90 degrees because it's still fired up, and that meniscus is still a problematic structure, then it's time to start talking about, is it valuable to have some sort of surgical intervention? And I think the problem is that people believe that I strained my knee, it's really swollen, it's really irritated, and there's something in there for sure that is going to need surgery. And I'm going to say 2 things about that. Procrastination is an excellent strategy when it comes to that. Seeing how it goes, right? Can we get this knee to calm down and heal up and strengthen up on its own without surgical intervention? And that takes patience. And most people don't want to spend the time to allow this thing to heal up the way it should. That's number 1. Number 2, even if you wait for 6 to 8 weeks, you're not likely to do a tremendous amount of damage to this knee such that it's going to have a more extensive surgery, right? People kind of believe that, especially in the shoulder, like, oh, if I had this surgery 6 months prior, then it would have been much easier post-surgical rehab. I don't necessarily buy that. There are times where potentially a rotator cuff could retract back up in the shoulder and it becomes non-operable in older patients. There are times, but for the most part, allowing something to heal, getting the whole body moving properly prior to having any kind of imaging, prior to having any kind of surgical intervention is the way. Because let's go back to this shoulder case. If you tore your rotator cuff, let's say lifting a paint can out of the back of a pickup truck, part of the reason why that rotator cuff tore is because your shoulder was in a disadvantageous place. And part of that has to do with, likely, your mid-back and your ribs and your neck and your shoulder blade and your collarbone not moving properly. And if those things are kind of stuck in that forward flex slumped position, that's part of the reason why there was more stress on that rotator cuff. Now, if you go in and have surgery done on that torn rotator cuff, you can sew that muscle back down to the bone. But what you haven't done is gotten all of the shoulder girdle moving better, the neck, the upper back, the ribs, the scapula. And if that stuff isn't moving well, once that surgery is healed, you still have all of that stiffness and biomechanical dysfunction. Now, we can post-surgically get that moving And we should, as physical therapists, identify that this person has a bunch of biomechanical dysfunction in the upper quarter that is contributing to this problem. But a lot of times that doesn't happen. And so now you had this repair, but you still have the stiffness and weakness of the muscles associated with the upper back and neck and shoulder blade that is going to contribute to a problem going forward, right? So that's where you see people having surgery over and over again, where like, oh, I retore my rotator cuff that I had done 2 or 3 years ago. It's like, well, how is that postural dysfunction going?
Right. So do you think there's anything that people can start to do at home, or is there also like a definite situation we should be working with somebody? What's your take on that?
I think that you should, again, like, let's say you strain that shoulder. If you can get your mid-back moving, if you can get your neck moving, if you can get your shoulder blades moving, get everything around that painful structure moving, and that doesn't help, then you should seek some professional help. Get into a decent physical therapist and at least go in for an initial evaluation and see what they have to say about how you're moving, and get some ideas about what's going on and where to start with getting some better mobility. And then maybe you could go as few as once every 2 weeks and get a lot out of physical therapy, because you could have that person work on some of those stiff areas, give you some new exercises to do over a 2-week period. So even if you're paying out of pocket, even if you're paying, say, I don't know, $200 a visit for a cash-based PT once every 2 weeks, that can be an incredibly valuable way to work through some of these issues without having to go the route of injections and surgery, because you start talking about thousands of dollars when you start talking about MRIs and X-rays and a bunch of other investigation. So what can people do at home? Again, try to get yourself moving, but avoid that stretch that reproduces the painful that original pain. That is my biggest advice, is don't just beat the heck out of that painful structure that you just irritated.
That makes sense for sure.
Yeah.
How does physical therapy fit into the medical system? Is there some coinciding things there, or is there some conflict sometimes? How does that all fit in?
Well, yeah. I mean, it can be pretty frustrating. I'll give you an example. We have a lot of insurance companies that require patients to do 6 visits of physical therapy before they can get an injection in their low back or an MRI. So quite often I have patients who come into my office and the first thing that comes out of their mouth is, I don't think physical therapy can help me. I'm just here because I need 6 visits so that I can get my MRI, so I can figure out what's going on and fix the problem. And there's so much wrong with that statement. there's so much wrong with everything about that thought process that it's really frustrating. And sometimes it's practitioners, right? Sometimes a practitioner who wants to do an injection is frustrated with the insurance company for forcing the person to do physical therapy before they get an injection. But for the most part, while I hate to be on the side of an insurance company, that's actually the right answer. You should be doing physical therapy. You should not be doing injections, cortisone injections, without getting the whole system moving better, right? A cortisone injection can be a very valuable thing so that you can tolerate more activity and physical therapy and stretching and strengthening, right? The whole point of the injection would be a temporary relief of pain such that you can tolerate doing other activities to get your body moving properly so that it doesn't come back. But all too often I'm seeing patients over and over again who are using these injections as like, okay, well, whenever my back gets sore, I just go and have an injection, and then I just go and have another injection. It's like, well, number one, that cortisone probably is not so fantastic for you, and it's also just not a great a strategy, right? It's not a long-term strategy. It's like using a short-term strategy for a long-term problem. You know, I mean, if you woke up tired every single morning, you know, just taking a tiny drop of methamphetamine probably is not the right answer. You know, like you probably should figure out a more holistic approach to that.
Definitely. I mean, what would you consider musculoskeletal health as a whole? I know we've been talking about it like
Yeah.
throughout, but is there like anything that would you consider is missing in the medical system?
Yeah, so I think we focus way too much on pain when we talk about musculoskeletal health, right? Pain is an important factor. I don't doubt that, and I don't disagree with that. But pain is only one aspect of musculoskeletal health. Mobility, range of motion, strength, coordination, balance, function, those are all really important parts of what is musculoskeletal health. So a lot of times I have people come in and they say, well, you know, my neck hurts really bad. And I say, okay, well, tell me some of the things that you want to be able to do by the time we're done without neck pain. And they're like, I don't know. I don't care. I just want the pain to go away. I don't want to do anything. I just want the pain to go away. And it's like, well, I don't think that's true. I think you want the pain to go away, but I think you also want to be able to do a bunch of functional activities. And to do those functional activities, you need range of motion, you need strength, you need coordination. So in terms of musculoskeletal health, when I talk to like when I see young people like you come into my office, most of the time, my young people who are exercising as you are, it's great. I love it because I don't have to do that much. You're doing a lot of really good and right things, but typically my young people are doing a bunch of lifting and a little bit of cardio and almost no stretching. And so all I have to do is get them to do just a teeny bit less lifting and a teeny bit more stretching and mobility work, and we've kind of evened a lot of that stuff out. For my older folks, right, when I have somebody who comes in and they're in their 7th decade of life and they're pretty stiff and they're pretty weak and their balance is pretty terrible, a lot of what I'm really looking for is how can I take this person, improve their function, strength, balance, and pain, but also give them a program that will keep that maintenance of all of this into their 8th and 9th decade. Because what you find with people who are in their 70s and their 80s, they decline very, very, very quickly. And I think if I can get people to understand that maintaining their mobility, maintaining their strength, maintaining their balance, maintaining their function, that maintenance over a 10-year period is going to pay off incredible dividends in the future.
Absolutely. What role does mindfulness play when it comes to pain?
Okay. So when I start working with someone who has more chronic pain, I have to really start asking, we need to really start working on the idea of what pain is, right? When we start talking about some of the pain science, we start thinking about pain as a sense, right? So one of my metaphors that I use is cilantro, right? There's lots of people who, when they taste cilantro, it tastes terrible, and their body is reacting as if it is a neurotoxin. And so I think we can all agree that cilantro is not a neurotoxin, but their brain is acting as if it is. And so you can retrain your brain. Those folks who don't like the taste of cilantro can work on it and do what's called graded exposure, where you have a tiny bit more, a tiny bit more, a tiny bit more over a long period of time, and you can retrain your brain to recognize that this is not a threat, this is not a neurotoxin, and I don't need to have this reaction to it. So when we start talking about chronic pain, we have to recognize that pain is always a manifestation of our brain, right? Every painful sensation that we have is produced 100% in the brain, and it is an interpretation of what the brain is experiencing from the world, and sometimes that your brain experiences that sensation as a threat, and that's when your brain gives you that feeling of pain. So a lot of times we're trying to decrease the threat level by getting people to recognize that the movement is not dangerous. So a lot of times when people with chronic pain come in, I'm asking them to move in a bunch of different ways, and I'm asking them to feel their body. Like, how does it feel when you move to the right? How does it feel when you move to the left? Is there a difference between those two? And most of the time they will say, I don't really feel a difference. It's like, well, there is a massive difference between your range of motion on either side. Do you feel that? Not really. And I have them do it a bunch of different times until they kind of feel like, okay, I can now feel there is a difference in how my body is moving. Because once you can feel that, then you can start to feel the changes that we're going to make when we free up some of these joints that aren't moving well, and then we can come back to some of those original motions and say, okay, now how does that feel? And the person can say, oh yeah, now I can feel that I have more movement, I have more ability to smoothly transition from one position to another. What that does is that teaches the brain that, okay, the threat level of this movement or position is less. And a lot of times what we were doing is quite literally a neuroplasticity of changing the person's idea and concept of what is a movement that is dangerous and what is a threat in terms of musculoskeletal. So chronic pain can be a very interesting realm to work with, because it becomes more of a neuroplasticity exercise than a mechanical bones and muscles and pulleys and levers sort of activity.
That makes sense. So basically, kind of learning how to move without pain, kind of like almost desensitizing. Do I have that right?
Yeah, desensitizing I think is an interesting term, but I think it's more like your graded exposure, right? You're exposing your body to these forces and getting it to recognize that it's not a dangerous situation. It's not a situation that is a threat, and then when you start talking about, again, with chronic pain, you start talking about all the other aspects in terms of stress and anxiety and sleep and hormones and all kinds of different things.
Definitely. I mean, I feel like because when it comes to chronic pain, like people are just so used to feeling it. It's kind of like, once they heal from that, obviously it takes longer because you've had it longer, but I just feel like, I don't know, it's an amazing feeling, honestly, like when you kind of learn to remove in a healthy manner without actually feeling the pain you've always felt.
Mm. Yeah. And it's nice from a physical therapy standpoint, because I'm not just saying to the person, okay, I want you to move in these different ways. I can facilitate that by wiggling some joints a little bit and freeing stuff up and changing the way their body actually moves mechanically, which gives them a different neural input. And that different neural input they can sort of imprint onto, okay, this is a safe movement now, and I can tolerate how this is going to go. And that can be a really powerful way to help people out of it. And because that snowballs, right? When you have something that feels a little bit better and they can tolerate a little bit more, then all of a sudden they're willing to try something else. And if that goes well, you can continue that graded exposure and ramp up the loading and the challenge until where you really see gains is when the challenge becomes more than their normal daily activities. Right? When your exercise is more than your normal daily activities, then your normal daily activities become much easier compared to what you're able to tolerate, and that's when you start really feeling good, right? People who feel good, they're waking up and getting out of bed is not a struggle, right?
That makes sense. Do you find that visualization plays a role at all in the path to actually relieving pain?
I guess I've never used visualization. I've never explored that, but I think your attitude, it makes a huge difference, right? You know, people who believe that they're going to get better, and people who believe that they can't get better, no matter how simple or small the problem is, they will not get better. So I think attitude is probably one of the biggest drivers of whether or not a person is going to be successful in physical therapy.
Yeah, man. I mean, that just explains the power of the mind, right? It's
Yeah.
like, because not only does it dictate our actions, but we can kind of like dictate our hormones in a sense. Is like we can produce like these stress hormones just by like believing that this is just going to be forever and we can't get well. But actually believing that in the process, like trusting the process, is so important.
hmm Yeah. Well, and again, the person who I like to call it a thought virus, the person who has a thought virus, where okay, I couldn't, my back is trashed and it can't get any better, and I'm just doing this physical therapy for 6 visits so that I can get my cortisone injection. It's like, well, obviously they're coming into this situation with incredibly negative attitude, and probably maybe even have been told by another practitioner that physical therapy can't work, despite the fact that that other practitioner doesn't actually know what physical therapy actually does or what the mechanics of what we're going to do is. And so obviously we're setting ourselves up for failure in that kind of situation. So yeah, I mean, obviously having a good attitude and having a positive attitude of what can we get out of this is a really, really important factor.
Absolutely, I hear it all the time. Like people just say like I have a bum knee or a bad elbow, but I feel like that language itself, it's like it's kind of dictating their actions in a sense. Like at least be open to the fact that things could change.
Absolutely. And even if that knee has been painful for a very long time, that could be associated with a back and a pelvis and a hip that hasn't been doing what it's been supposed to do for a really long time. So if we change that system and we improve how everything's working, there's no reason to believe that that knee couldn't heal itself. I mean, the body has a tremendous healing capacity, and I think people kind of forget that. We have such an amazing ability to restore normal function and strength and coordination, that, but it takes time. I think that's the other piece, right? That people just want it. People want it done now, and they think there are some shortcuts, and unfortunately, it's like most of the working out world. There is no shortcut to this process.
100%. I mean, just knowing that, like, just because it's how it was doesn't mean it can be our future, right? Just believing in whatever we're doing, believing in the process, again, it's awesome. So, to ask something a little bit different, what is your take on icing? Like, is that something that is worth healing the process? Because I hear mixed things. I'm just curious.
Yeah, it seems like there's some new research out there that is anti-icing. I don't know. My feeling on ice and heat is, if it feels good, then do it, right? And if by icing your knee down or heating it up for 15 minutes, that feels good, then that's great. The reality is that you're probably not cooling off the joint very much, because the blood flow around that knee is taking the cold out of that situation, and you're certainly not heating it up much with that hot pack. So ice and heat, again, can be beneficial in terms of feeling good. I don't know that they are actually tremendously valuable in terms of a curative modality.
That makes sense. I mean, like most people, they would, at least in the past, they would always like ice, right? But like you said, there's some new things. I don't know, right? So it's kind of like, just like you're saying, it kind of depends, right?
And it sounds like, I mean, some of the research they're talking about where the cells that are rebuilding some of those soft tissues are inhibited by ice. So I don't know.
Yeah.
I don't know what to say. But again, you're not icing it all day. You're only icing it for 15 minutes at a time, maybe a couple of times a day. So how much are you inhibiting those structures? I don't know.
Makes sense. Something I see common is plantar fasciitis. Do
Yeah.
you see that pretty often?
Yeah, yeah. I mean, I work with all the itises, right? Anything that is a an itis of musculoskeletal nature, I work with all of that. So, if we think about the structure of the plantar fascia, basically it is a continuation of the calf, right? The calf goes in the Achilles tendon attaches to the heel, and then the plantar fascia attaches from the heel out into the metatarsals. So really what you're talking about is the structure that is the last little bit of the calf. And what I would say again, just always, the painful structure is the victim, not the culprit. The painful structure has more stress on it than it should and is not tolerating that stress because there are things around it not doing its job. So many times I find that the person has hip, pelvis, low back stuff that is creating a scenario in which that leg is not hitting the ground in an efficient way or is not ending the stride in an efficient way. I sort of joke with my students. I asked Kyle this, my new student, on the first day. I said, "What is the foot?" Can you answer that question? What is the foot?
Are you asking me?
Yeah, I'm asking you. What is the foot?
Yeah, the foot. I mean, that's the foundation, really. It's like where everything kind of stems from. It's like everything. If it's pain, it kind of goes up the kinetic chain. Do I have that right?
Well, there's different ways to think about things, right? There's different ways to think about things. I sort of jokingly say the foot is the end of the leg, right? That's what the foot is, right? And the foot is a victim of circumstance, right? The foot hits the ground not because the foot wants to be in that position when it hits the ground. The foot hits the ground how it hits the ground because the leg put it there. And the job of the foot is to transfer load from the leg to the ground and accommodate to an uneven surface and maybe do some propelling forward and whatnot. But really, to me, it's a structure that creates, again, just like you're saying, a base for the leg to interact with the ground and move the body where it's supposed to go. I think, like a lot of people talk about the foot as a foundation, and they talk about how it affects upwards. And I would say I'm more of a person that thinks about how the low back, the pelvis, and the hip change how the leg moves during gait, such that the foot hits the ground in a certain way. So if you think about the extreme, right? If you take your foot and you turn it way, way, way out, and you start walking with your toe at a 90-degree angle to your body, and you walk around like that, your foot is not going to be very happy with that situation, right? But it has nothing to do with the foot. You didn't change anything about the foot. That's all coming from the hip and up higher. If you go the opposite way, where you toe way, way in, where you're 30 degrees toed in, and you start walking around, again, different parts of your feet are not going to be happy with that, or maybe your knee isn't going to be happy with that. But that, again, it has nothing to do with changing the foot. So a lot of times I find that that people are trying to do things to the foot to try to, I don't know, make it work better. So for instance, I'm not typically a huge fan of orthotics, and I'm not typically a huge fan of shoes that try to make the foot do a certain thing, right? The idea, just think about this concept for a minute. Your foot, people have been evolving for, let's say, millions of years, right? And we have had nothing on our feet up until maybe, 3,000 years ago, and then we put some sandals on, and then somewhere around like 1960 75, 80 or something like that, we decided that the foot needed a special arch underneath it. And then we found these like running shoes where we had to run, where we had this certain foam that made the foot move in a certain way so that it would tolerate these different things. And it's like, well, wait a second. This foot has been working for millions of years just fine and running all over the place just fine, and now we've decided that it needs a help. It needs a helping hand, and it needs to be put in this specific position to work right, or so that it can affect the joints above it properly. So I don't know. I guess I'm more on the side of doing a little bit of barefoot running and getting your foot moving well and strong and coordinating with the rest of your body, rather than trying to push it up with certain orthotics or special shoes that are supposed to do different things. So to get back to your plantar fascia question, I think that if the foot is the end of the leg and the structure at the end of the leg is painful, it is because something above it isn't working properly. So if you're struggling with plantar fasciitis, going in there and rolling ice on the bottom of your foot, as people do, right? Trying to release the plantar fascia is not the right answer, right? Just going in there and beating the snot out of a soft tissue structure because it is painful, again, that is punching the hippie, and that is, in my view, not the right answer. Certainly, making sure the calf is moving properly is a very important piece, but I would look up higher into the back and pelvis and hips.
Absolutely. So, are you a fan of minimalist shoes?
I don't know. I guess I'm a fan of allowing the foot to do what it's supposed to do. I think, I don't know. I guess I don't know enough about minimalist shoes to say one way or the other, but it sure seems to me that putting the foot in a shoe that is trying to force the foot or ankle to do a certain thing, I don't think is the right answer. So I think some of these shoes that have a good amount of cushioning but allow the foot to work however it wants to work is probably the right answer in my view. But also, I think it's good to do some barefoot activities. Now, then you get into some challenges with whether or not you're going to injure your foot by stepping on something, because our feet are, my wife always jokes about how my feet are so like tender I can barely even like walk on a sidewalk. If there's a tiny pebble, I can't tolerate it. But so, yeah, I guess I would steer towards a little bit more towards minimalist shoes rather than maximalist shoes, I guess.
Yeah, that makes sense. All right, man, this has been awesome. Like, there's so much we can cover in terms of this, in terms of body integrity, body structure, and all that. But I think we covered a lot today. I appreciate you so much for coming on the show, man. Is there anything that people can do to get connected with you and all your work?
I have a Facebook group that is Start With PT. So if you just go to facebook.com and Start With PT, that's just where I put some of my ideas down and just specific patients where their situation I thought was apropos to a broader audience. And I'm just trying to get the idea out there that if people have pain, if they have a joint or a soft tissue structure that is in pain, then the best place is to start by getting the body moving well, the whole region moving well and strong. And you do that most effectively by going to see a professional and having it all checked out. And then if that person sees a structure that is in such bad shape that it probably, you need to have a hole in your body, then that's when you start talking to a surgeon. So I think people are, my whole mantra, these days is don't just jump to the end and try to do the most expensive and most invasive thing. Start where you should be starting, which is physical therapy.
Definitely, man. I appreciate you so much for coming on and sharing our insights with us. It's been a pleasure.
Hey, I appreciate you having me on.
All right, awesome.